Welcome everyone. Welcome again to our subject Foundations of Special and Inclusive Education. Last time we've discussed about the learners with additional needs, particularly the learners who are gifted and talented and learners with difficulty hearing. So today we will discuss about the learners with difficulty with communicating. So some learners are observed to have difficulty communicating either verbally, expressing their ideas and needs, and in understanding what others are saying. Some may have had a clinical diagnosis of a disability, while others display developmental delays and difficulty in the speech and language domain. To have a clearer understanding of students who have difficulty communicating, we will begin with a definition of communication and its accompanying concepts. How learners with communications difficulties are identified, their learning characteristics, and ways how to keep them managed and become successful in an inclusive learning. So these are the types of communication impairments and disorder. Number one is we have the communication. So this is the interactive exchange of information, ideas, feelings, needs, and desires between among people. So communication is used to serve several functions, particularly to narrate, explain, inform, request or demand, and express feelings and opinion. Next is we have the speech. This is the expression of language with sounds or oral production. Speech is produced through precise physiological and neuromuscular coordination. So number one, that is the respiration or the act of breathing. Phonation, that is the production of sound by the larynx and vocal cords. And the third one is articulation. This is the use of lips, tongue, teeth, and hard and soft palates to speak. Next is we have the language. This is used for communication, a formalized code used by a group of people to communicate with one another that is primarily arbitrary. So people decide on symbols, their corresponding meaning, and rules that make up a language. So there are 5 dimensions of language that describe its form. So we have the components of language. Number 1 is the phonology. So this refers to the sound system of a language. So a phoneme is the smallest unit of sound within a language. So for example, here, the word dog is made up of 3 phonemes. That is the g, dog. That is the phonemic awareness or the phonology or the phonemes. Next is we have the morphology. So this refers to the smallest unit of language that has meaning and which are used to combine words. So sounds, syllables, or whole words are example of morphemes. So for example, here in morphology, we have the morphology. We have the 3 syllables in morphology that is called the morphemes. Next is the syntax. So this is the system of rules governing the meaningful arrangement of words and also include grammar rules. So for example, in a sentence, ready, get for the exam does not make sense until arranged in the right sequence as get ready for the exam. Next is we have the semantics. So semantics refers to the meanings associated with words and combination of words in a language. This also includes vocabulary, concept development, connotative meanings of words, and categories. Next is we have the pragmatics. So this revolves around the social use of language, knowing what, when, and how to communicate and use language in a specific context. So there are 3 kinds of pragmatic skills. Number 1 is using language for different purposes. So for example, narrating, explaining, or requesting. Second is changing language according to the context. So for example, talking to a peer as compared to speaking to a well-respected professor. Third is following rules for conversations and storytelling. So for example, is taking turns, rephrasing when unclear, how to use facial expressions, and eye contacts. So knowing these terms is necessary to understand the different disabilities that are associated with communication disorder. So we have what we call here the speech impairments. So these are the communication disorders such as stuttering, impaired articulation, and language or voice impairment. Such disorders are significant enough that they can adversely affect a student's academic performance. So we have here 4 basic types of speech impairments. Number 1 is we have the articulation disorder. So in articulation, a child is unable to produce a given sound physically. Severe articulation disorder may render a child's speech unintelligible. For examples are substitutions, omissions, distortions, and additions of speech and sound. So I have here a video clip that will show you the example of articulation disorder.
Elizabeth. How old are you, Elizabeth?
3.
Elizabeth is going to tell us a story so that we can look at her speech and articulation skills within a connected speech sample. All right, Elizabeth, tell us your story.
Once upon a time, there was a little puppet named Pinocchio. His father painted him, and then the blue fairy come and changed him alive, and then Pinocchio's nose glowed, and then the blue fairy comes again and fixed his nose, and Jimmy Cricket said, "We're free." And then the fox said, "Up to the feather." And
So the video clip shows that the child is unable to produce a given sound physically. So for example, the child will say or want to say, "I want a blue lollipop." So if you have articulation disorder, the child will say, "I want a blue lollipop." So that is example of articulation disorder. Next is we have the phonological disorder. So this is a child produces multiple patterns of sound errors with obvious impairment of intelligibility. There is also noted inconsistent misarticulation of sound. So for example, sometimes a child is able to articulate it but not in other words. So I have here again a video clip or short video clip that will show you or explain to you what is a phonological disorder.
I see a tat. Where is the tat? No, a tat.
So what the child is trying to say is, "I saw a cat." So instead of saying a cat, she said a tat. So another example is, what is the child trying to say is, "The pie is good," but if you have phonological disorder, "cat pie is chewed." So that is the phonological disorder. So you produces a multiple patterns of sound errors. Next is we have the fluency disorder. Difficulties with the rhythm and timing of speech. Stuttering is an example marked by rapid-fire repetitions of consonant or vowel sounds, especially at the beginning of words, prolongations, hesitations, interjections, and complete verbal blocks. So I have here again a short video clip that will show you an example of fluency disorder.
Stuttering is when my words get stuck, like I just did. Stuttering is not something that you can help, something that just comes along with some people.
I get worried, like what other people might think if I do stutter.
Kids should ignore the people tease them about stuttering because it's not their fault. I worry about it when, like, I'm on S words, and they always get me stuck on stuff. Anywhere with an S. At the beginning.
Help us help those who stutter. Donate now to the Stuttering Foundation of America.
So this is the short video clip shows to you the example of children with stuttering or with fluency disorder. Next is we have the voice disorder. So problems with the quality or use of one's voice resulting from disorder of the larynx. Voice may be excessively hoarse, breathy, or too high pitch.
Hello, I'm Lori Vick from University Hospitals. Our voice plays a big role in our lives. Well, what if it started changing and you didn't know why? In today's Your Health, that's exactly what happens to patients with a voice disorder.
When I started to see Dr. Riley, I could barely talk. I mean, my voice was shaking so bad, you couldn't understand me.
14 years ago, Liane Schmaltz became a patient of Dr. David Riley, the director of the Movement Disorder Center at University Hospital's Neurological Institute. She was diagnosed with a disorder of the larynx or voice box called spasmodic dysphonia.
Now, what happens when people have spasmodic dysphonia usually is that their vocal cords are pulled too tightly together and they have to force the air out to make any sound.
The main treatment for spasmodic dysphonia is Botox injections. It's the same Botox that's used for cosmetic purposes, but in this case, it's injected directly into the muscles that control the vocal cords, forcing them to relax.
The vocal cords are allowed to assume a more normal position, and the voice sounds normal as a result.
My voice sounds probably 100% better now.
And Liane's using that voice to reach out to others.
People that have a problem or think they have a problem with their voice, I hope they'll seek help. And there is help to be found.
For more information, call 1-866-UH4CARE or visit our website.
So the video clip shows to you the example of voice disorder. So those are the types of speech impairments. So we have the articulation disorder, we have the phonological disorder, we have the fluency disorder, and we have the voice disorder. Next is let's now discuss the language disorders. So this involve problems in one or more of the 5 components of language and are often classified as expressive or receptive. So language disorder are characterized by persistent difficulties in acquiring use of language that results from deficits in comprehension that include reduced vocabulary, limited sentence structure, and impairments in discourse that limit a child's functioning. So to receive a diagnosis of language disorder, the difficulties must not be due to an accompanying medical or neurological condition, and other developmental disability, for example, is intellectual disability or global developmental delay. So there are different types of language disorder. We have the expressive language disorder. So when we say expressive language disorder, this interferes with the production of language. A child may have very limited vocabulary that impacts communication skills or misuses words and phrases in sentences. Also, I have here a video clip that will show you the example of the expressive.
Welcome to Talk About. On our website, you'll find lots of information to help you if you care for young children with speech, language, and communication needs. In this short film, I will focus on how you can support children with expressive language difficulties. These children struggle to put into the right words what it is they want to say, or they may have difficulty using sentences that other people can easily understand.
So we first noticed there were some concerns about Rosa's speech and language development when she was at nursery, approaching around the age of 4. And we noticed that compared to her peers, she seemed to be having some difficulty in making some sounds.
Providing a language-rich environment during the first few years of life has a hugely positive impact on how well children learn to express themselves through language. Whether we're caring for children at home or in preschool, we should ensure they have lots of opportunities to enjoy talking with us and have fun trying out their new skill of talking. If we don't provide this positive environment, some children will be at risk of developing expressive language difficulties. There are other risk factors too, which can contribute to expressive language difficulties, such as a child having hearing loss, developmental delay, a learning difficulty, or a specific language impairment. But whatever the reason, there are lots of things we can all do to help these children communicate with confidence. So how do we know if a child has expressive language difficulties? It is much easier to identify than receptive language difficulties, but do be aware the two can be linked. The first thing to consider is whether the child's expressive language seems limited compared to other children of their age, and this indicates a delay in their expressive language development. Or they may use a more limited number of words than other children of their age, again indicating delay.
So when we were thinking about the difficulties that Rosa might be having with her speech and language, I had quite mixed feelings because Rosa doesn't have any siblings, so I didn't really have anything to compare it with. So I didn't kind of really know how far away from like a kind of average or usual range that she was. And I felt quite torn between thinking that children develop at their own pace, and I didn't want to kind of label or stigmatise something that may or may not be a problem, maybe within the usual range. But at the same time, I didn't want to not take action that was going to help her develop her speech and language if there was a problem.
Children with an expressive language disorder can also have trouble saying words in the right order, so their sentences can sound muddled. For example, instead of saying, "I don't want a drink," it might come out as, "No, I want drink," or "Want drink, no."
One of the things we did notice sometimes was that although sometimes it was really fast and she couldn't wait to get the words out, sometimes there would be a bit of a pause and she'd sort of roll her eyes up a little bit, thinking, trying to kind of find the words.
Words we use to indicate past and present, like ran or run, can also be tricky. But we have to remember that lots of preschool children take time to master these, so on its own it's not an indication of an expressive language difficulty. In some cases, these children use sentences that we can't easily understand. We can just pick out the occasional recognizable word mixed in with lots of other unintelligible sounds. Sometimes children with expressive language difficulties use vague words instead of the exact words. So, for example, if a child wanted to tell you about a ladder, see over there, he might say that thing over there instead of that ladder over there. And they commonly use gestures to help us understand what they want to say. So, a child might use the rabbit ears instead of the word rabbit if he doesn't know the word rabbit yet. When young children have trouble talking, it can be easy for them to give up. So we need to encourage them to keep talking without pressurizing them too much. Don't keep asking them questions, as questions can be too much pressure and lead to children clamming up. Instead, create a need for the...
So this is some of the symptoms that indicated that the children or a child has a or an expressive language disorder. So next we have what we call the receptive language disorder. So this interferes with the understanding of language. A child may have difficulty understanding spoken sentences or following the directions a teacher gives. So some children may be found to have a combination of receptive and expressive language disorder.
Hey, can you say your ABCs for me? Hey, can you say your ABCs for me? Yay! How about we do it together? Ready? Ready? Hold on, let's start at the same time, okay? Go. A, B, C, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, and Z. Now I know my ABCs. Next time, won't you sing with me? Yay! Christian, come here. Tell me how old you are. How old are you?
4.
You're 3.
I'll be 4.
When are you going to be 4?
1.
Huh?
I want to be 1.
You want to be 1? Why do you want to be 1?
Fortune of my birthday time.
Your birthday's coming up?
Yes.
And how old are you going to be?
4.
4?
Yes.
What do you want for your birthday?
Space, our space buster, space bubble to together.
SpongeBob?
SpongeBob ice cream.
SpongeBob ice cream?
Yes.
What else do you want?
Space Bob.
What about, do you want, you like Backyardigans? How about Transformers?
Transformer, yes.
You like Transformer robots?
Yes.
How do they act?
Because they fight them.
How do they act? What do they do?
Because they fight that in the first
Really? Show me what the Transformer robot does.
Ice cream.
Do you know what it does?
Yes.
How do they act?
Fire.
How does a Transformer robot act?
Because the act just like in the TV.
Because they do?
Yes, they do fight.
How do they fight? What do they do? Can you show me?
Yes, but they fight over this.
Do they go?
And the way.
Do they do that?
And the doorway. And the doorway.
Show me what they do.
And the doorway they cut them. They cut them. Cut you.
You cut them?
And
This doesn't sound very nice.
they cut you.
Uh-oh.
They cut that. This one cut you, right? They can cut this. Cut this one. The back cut this.
Well, Christian, come over here.
Oh.
Can you say bye?
Bye.
Say, I'll see you later.
See you later.
So that is the example of receptive language disorder. As you can see, the child has difficulty in understanding the language, and some of the symptoms is that the child has difficulty in production of language. So the video clip shows that this is a combination of receptive and expressive language disorder. So at this point, it is also essential to mention that students with autism spectrum disorder also display speech and language difficulties. So the ASD is an umbrella term for related disorders that affect social development and communication. Students with autism spectrum disorder display a triad of impairments in social relationships, social communication, and social understanding. Other disorders that are subsumed under is the Rett syndrome, pervasive developmental disorder, and Asperger's syndromes. So, the communication difficulty is often times one of the most common red flags observed by family members, daycare workers, and early childhood teachers. Noted absence, delays, and difficulties in speech and or language often prompt family members to consult their general pediatrician, who then makes referrals to developmental pediatricians and other specialists. To screen children with communication difficulties, early childhood professionals use questionnaires and developmental checklists to determine the severity of the delay as compared with typical language development. So, upon screening, a child may receive educational supports and accommodation to help address the delay. If the difficulty is pronounced, referrals can already be made to developmental pediatrician and a speech that language pathologist. So, at times, referrals are also made to an occupational therapist if a speech difficulty is resulting from motor problems. So, how do specialists determine a speech or a language problem? So, a comprehensive speech and language evaluation to determine the presence of a communication disorder involves several components. Number one is we have the case history and physical examination. So, assessment always begin with the case history that provides the specialist the necessary background about the child's birth and developmental history, health record, achievement, test scores, and adjustment in school. The specialist examines the child's oral peripheral mechanism, which includes the mouth, noting irregularities in the tongue, lips, teeth, palate, or other structures that may affect speech production. Next is we have the hearing. So, hearing is tested to determine whether an organic hearing problem is the cause of the suspected communication disorder as discussed in the previous section. So, hearing impairment needs to be treated to develop speech and language skills. Next is we have the articulation. So, a child's articulation skills are assessed, which includes identifying speech errors. Next is the phonological awareness and processing. So this provide the foundation for beginning to read in young children. So children with difficulties in processing sounds in language as well as in hearing, segmenting and identifying phonemes in words may experience a problem with expressive and receptive spoken language as well as in learning how to read. Next is we have the overall language development and vocabulary. So formal tests may be used to measure a child's overall language development and vocabulary, as this affect how well a child is able to understand and use language in spontaneous speech and in academic settings. Next is we have the assessment of language function. So language is used to serve several functions such as to request, name, imitate, ask, and converse, among others. So according to B.F. Skinner, emphasize how language is used rather than the structure and form of language. Next is, and lastly, the language samples and observation in natural settings. So language difficulties may also be identified through play-based, authentic assessment, or a special place with a child during which spontaneous speech and verbalizations can be elicited. So next is we have the learning characteristics. So children with communication disorders frequently struggle across social settings, whether at home, school, or in other places in the communities. So some of the difficulties that characterize communication disorders are the following. So number one is we have the expressive language difficulties and the receptive language difficulties. So in expressive, we have the limited vocabulary, incorrect grammar or syntax, expressive repetition of information, difficulty in formulating questions, and difficulty constructing sentences. In receptive language difficulties, we have following oral directions, understanding humor or figurative language, comprehending compound and complex sentences, and responding to questions appropriately. So children with communication disorder may also experience behavioral difficulties because they struggle in expressing their needs and ideas. Some children resort to inappropriate behavior out of frustration or to get the attention of significant others. So, for example, a 5-year-old child with expressive language disorder may resort to grabbing toys and hitting his peers who tried to take the toy he was playing with the day before. While typically developing children will be able to say, "May I please borrow?" or "It's my turn now." A child with communication actions resulting to physical aggression, thus it is essential that teachers and professionals take this into consideration when working with children with communication disorders and difficulties. So such feelings of frustration may even become worse when peers or adults are unable to understand them. So for general educational adaptations, we have here what we call the universal design for learning. So use of UDL in classroom allows children to learn information, demonstrate understanding, and stay engaged in multiple ways. So for example, multiple means of presentation, expression, and engagement. Next is we have the practical tips for the classroom. So in addition to the UDL, there are we have here practical tips and techniques that teachers can use. So number 1 is allow the child to sit near the teacher and blackboard, away from auditory and visual distractions such as the window and the door. Get the child's attention before giving directions. Call the child's name or use a prearranged signal. Tap on the table or hand on the shoulder to help the child focus and listen to the directions. Use picture charts and other visual aids when explaining content to supplement auditory information. Speak slowly and clearly without exaggerating speech. Simplify directions into short steps. Break down multi-step directions and give each one at a time instead of just repeating each one. Provide a written copy of directions for a task so the child can refer back to it at his or her own pace. Use gestures to clarify information. Use peer-mediated instruction so that peers without difficulties can serve as language models and learning buddies. Provide extra time to prepare for oral language activities. Do not call children with communication difficulties or disorder to recite first in class. Call other typically developing children first to serve as language models. Model correct language forms and use appropriate wait times, 3 to 5 seconds or more, to give the child time to think and respond. Last is the explicitly teach vocabulary that is needed in the learning context to promote better comprehension. So the UDL or the Universal Design for Learning, alongside different accommodations, presentation, response, setting, and timing that are appropriate to the child, and collaboration between the general education teacher and the special educational professional, will all help ensure that children with the communication difficulties or disorders have a chance to be successful in an inclusive classroom. So that's all for today's discussion. So I hope you understand something from our discussion. So hopefully we will finish this summer subject by next week, and we will have our final examination by first week or second week of December. So for your performance activity, answer the following questions. This consists of 30 points. Put your answer in the comment section below by following the format: your name, your block or cluster, and your answer. So the deadline of submission is on November 30, 2023, 8 o'clock p.m. only. So number 1 question is, what accommodations can be given to learners with communication difficulties? And choose one types of speech impairments and then describe. So again, thank you very much for listening and watching our recorded discussion. So God bless everybody.